The Regional Institute of Medical Sciences and State has been catering to the medical needs of the entire Northeast as well as neighbouring countries like Myanmar, apart from looking after the needs of the state. Now, 50 years into its glorious existence, the institute is all set for another massive facelift with new equipments and facilities at the door, enabled by proposed Rs 560 crore budget from the centre. Well, on the sidelines of the inauguration of RIMS Golden Jubilee Shushruta Hall, Hospital Director Professor A. Santa inspected the entire infrastructure as well as the newly installed machines and technology inside the hospital. Besides nursing college and a dental college, RIMS Hospital also has a super specialty block of cardiology, neurology, neurosurgery, gastroenterology, hematology, psychiatry and nephrology. Besides being equipped with the latest technology, CT scan, MRI, digital X-ray, installation of a modular operation theatre is also underway.
It will be very, very convenient for surgeon. It will be much easier for surgeon, anesthetic. And once doctors are comfortable and surgeons comfortable, then patient operation is very safe. It's very safe for the patient now. And we will be operating under the HIPAA filters like that. So there will be chances of infection post-operative will be much, much less. And not only that, it's very highly equipped actually, all of them. And particularly for teaching facilities. Suppose even when we operate, some people can see in the auditorium now. That's all the internet, then IT connection is all there. Very, very advanced actually. Efficiency is called golden hour. So whenever patient comes, earlier the patient comes is better for me because I'm a surgeon, ectopic pregnancy or anything. For me, why don't inform me early like that? So when you get early diagnosis, early get report is the best for us. And it's very good for patient, very good. And because anytime we call it the golden hours. So in the golden hour, you are able to do CT scan, X-ray. My God, this is a boon actually.
Overall patient response towards the RIMS hospital at present, sir?
Now, percentage-wise, so much is increased actually. I can see you the graph, no? Because of COVID, it was went down, but the graph increase-wise almost like, like 100%, 200% like that, number of the patients. So there's a whole of them like wanted. So that's why some people have so long waiting list in MRI, because our MRI is supposed to be one of the best, that's why.
Meanwhile, a Northeast Live also interacted with some health workers who were working outside the state in reputed hospitals but returned home during the pandemic.
I heard from this director, Professor A. Santa, that some of them serve at the Apollo Hospital, and they came down here. And just seeing the advertisement again, they applied for the job, and right now they are serving as the best nurses inside this ICU, neuro ICU. So, may I know good name first?
Sir, my name is Pamya Aungshi.
I see. And you?
Waikom Nelima.
Waikom Nelima. And you?
Mine Zanson Kim.
So, I heard about some of you just coming back from different private hospitals across the country, joining here at RIMS. My question is very simple. How you feel the facilities out here and facilities out there? How you are going to explain it? Just one line.
Like, it's very much improved here also. Like outside also it's improved a lot. Here also we can we find all the facilities needed here as well. Here in RIMS also.
Working outside and working here is different because here too I am giving care to my own state patient, that's why.
It's nice working in my hometown.
And earlier, the hospital had only one entry and one exit gate. But now, with the addition of a third gate, accessibility to the hospital will be less time consuming for patients, in the words of Professor A. Santa. Well, think like a common man to understand the difficulties of a common man.
Witnessing some new things, some creative idea. You see, earlier we entered the RIMS hospital from only one gate. Today, here witnessing another gate, and that is the pediatric emergency. Yes, as a reporter, as a layman, what I'm getting the idea is easy accessibility, less consuming time. Also here, coming here, we also know that the registration is free, sir.
Free.
How it would...
And
the idea behind how it comes.
I always think of patients on it. My thinking is always, if I come now, and why we come as a lay common man. Suppose when you stand for any queue for petrol, we always worry that queue should move. So how to move queue is very important for us.
My turn can come.
My turn can. That's why when I saw in the casualty, when crowded, and when we, for the particularly child, I don't want to stand for queue, very long. Then again, why should charge for 10 rupees? Again, another queue. Then why not we make it free? Then doctor is also very easy because this is their department. So doctor, otherwise doctor has to run to that place. When doctor is running, then he may lose some time. Then patient party will get angry. So these are all thinking in the night. I keep on thinking that how to solve it. But then building was already made. Then how to modernize it, that's very important for us.
It's a very significant line from Professor S. Hunter that think like a common man so that you can understand the difficulties of common man. With video journalist Roshan, this is Sharat Chandra reporting for Northeast Live from Imphal.